Doctors of Reddit, what's something you've had to tell a patient that you thought for sure was common knowledge? Vet here. I had this lady bring in her female cat who turned out to be pregnant. She was adamant that it was impossible, as this was strictly an indoor cat. Upon further questioning, she admitted that there was an intact Tom also living in the same house, but that he couldn't possibly have done it because he was the female cat's brother. Yeah, cats don't work that way. Had a lady measure her baby's temperature by preheating the oven and putting one hand in front of it while the other hand was on the baby's forehead. She told the nurse her baby's fever was about 250 degrees. Another vet here. Dead bodies decompose. If you leave your dead dog, euthanized in the back of your car on the hottest day of the year, don't come crying to me when its belly fills with putrefying gases and bursts, demanding I cover the costs of reupholstering. Your car might be considered a little rude as well. In a free medical clinic I had to tell a mother that she should be brushing her 4-year-old's teeth. The daughter came because her throat hurt. After opening her mouth and using a tongue depressor to see her throat, the daughter squirmed like 4-year-olds are prone to do, and the tongue depressor hit her gums. Pus flowed everywhere, and the child wound up having to be put on penicillin before having every last tooth pulled due to severe infection. Edit. RIP my inbox. You should start brushing your infant's teeth as soon as they start teething, and do a gentle gum massage with a baby toothbrush before that. Use safe to swallow toothpaste before the child is 10. Let the child brush their own teeth as soon as they are able, for practice, and then have an adult brush them at a 45-degree angle towards the gums in small circles. Children should be supervised brushing their teeth until they are at least 12 or longer if necessary. This occurred in Nicaragua, quite far from any major city, and wasn't reported because the mother did follow up and kept the appointment for extractions. The thought of brushing her daughter's teeth simply never arose. Before modern toothbrushes were invented, people used bones, porcupine quills, sticks, and chew sticks. The ancient Romans had toothbrushes as well. Here's what they looked like. Yes, you should brush your pet's teeth. Pet toothpaste only. No fluoride. No, I didn't murder the mother. She was provided with 6 months worth of dental supplies for both of them and thoroughly educated on dental hygiene. I once had a patient with a cancer diagnosis completely depressed about not being able to see their family anymore. I was confused because I had spoken with this individual's spouse and extended family who seemed supportive. There wasn't any indication of family problems, etc. It turns out that this individual thought genetic and family history had meant something similar to contagious, leading them to the conclusion that one should stay away from loved ones lest it be spread through the family. That was one clarification I was so happy to give. Thanks for the Reddit gold. It's a humbling award for a short story. To those wondering how such a misunderstanding is possible, keep in mind that we ought not to judge. Not everyone has the benefit of a good education, nor is everyone part of a generation and culture that has always had medicine and science in their lives. Other times language and jargon can be a barrier to understanding. I was not the physician that failed to communicate the issues effectively, but we were all glad that at least this problem could easily be dealt with. Podiatrist buddy told me this one lady has to have foot amputated and is given waiver forms to sign pre-op. Buddy asks if she needs time to think about it. She's very nonchalant and doesn't seem to care much what they do. He gets suspicious and probes a bit as to why she's not more concerned. She says she gets that they have to operate and it's okay because the foot will grow back. HD then has to explain she's not a salamander. Things get a bit more serious. Edit. Wow, top comment. This happened in Florida. The lady had to have op done anyway. But yeah, docs need legal training for just this reason. I remember watching some documentary once, and there was this lady who had diabetes and her foot was necrotic. The doctor told her she was going to have it amputated, and she said no, Jesus will heal it for me, or something like that. The doctor looked at her and said, "Mom, you have maggots eating your foot. Jesus wants you to get it amputated." Mom brought her kids to the ER after they ate all of their Halloween candy because they had tummy aches. They were still eating Reese's peanut butter cups when they were in the exam room. I had to explain to her that they need to cut back on the candy and she looked at me like I had 3 heads. One of my professors told me this story from when he was treating patients in a women's clinic. Apparently his woman was previously prescribed birth control pills, but still kept getting pregnant. She complained that she took her birth control every night and didn't know why it wasn't working. Finally, my professor found out that she wasn't actually swallowing her birth control pills. She put the pills up her vagina and thought that's how birth control pills work. No one ever thought they had to actually explain to her how to take the birth control. That they were 8 months pregnant. For almost a month, my friend had random pains. Bruises started showing up randomly. He looked at him, and what we first thought was him being lazy was actually him not having any energy. Finally his girlfriend got him to agree to go to the doctor, who sent him to the where it took several doctors to figure out what was wrong, either because none of them had actually seen it in real life before, or they didn't think someone could be that stupid. Quote the doctor, "You have scurvy. Eat a king orange." Not a doctor, but my ex-girlfriend had a severe peanut allergy, and one time she ate a Thai chicken pizza in the college cafeteria that did not list peanuts as one of the ingredients. After her throat started burning, she knew something was wrong, so she grabbed a glass of milk, which I guess helped a bit, and went outside for some air because she was having trouble breathing. A female security guard was passing outside in front of the building and saw that she might need some help. At this point my ex was looking through her bag for her EpiPen. The security guard asked what was wrong, and she tried to explain that she had a severe peanut allergy and needed to be taken to the hospital. When the security guard saw her take out the EpiPen, she took it from her and said that it was school policy that she be the one to do it. She then asked my ex to hold out her arm so she could inject her. My girlfriend could not believe that the security guard was trying to inject her arm like it was a flu shot, and out of frustration, she yanked it from the guard's hand and put it in her thigh like you are supposed to, and sternly told her, "I need to get to a hospital now." I went on a couple of dates with a girl who was a gynecologist. I got a text one day saying, "OMG, one of my patients is retarded. Their internal organs are prolapsing through their vagina because they thought it would be a good idea to douche with Listerine because they just had unprotected sex and didn't want to get pregnant, WTF. So don't douche with Listerine." My wife and I were trying to get pregnant, and due to possible complications we were talking to our obstetrician. Towards the end of the visit, he tells us, in all seriousness, "Just so you guys know, you have to stop using condoms if you want to get pregnant." We just stare at him a bit and say, "Obviously," and he just shakes his head and says you'd be surprised. There's been a few couples that really didn't realize that you're still sexually active, even if you are just on the bottom every time. Not a doctor but a paramedic. During clinical time in the ER, 17-year-old girl came in with a bloody rectum/anus. Apparently she wasn't wiping after using the bathroom, and it was basically really bad diaper rash. So the nurse had to call social services and explain to this girl proper wiping. Not a doctor, but my friend had to be told that the reason her son was getting sick at school every day was because she was packing him peanut butter sandwiches, and he was allergic to peanuts. She honestly didn't know that was an ingredient, and he was in middle school and wasn't bright enough to realize it himself. I told a friend of a friend that I had just completed my doctorate. He asked if I could write him a prescription. Sigh. My mom was a radiologist, retired now, and she regularly had to explain to patients that if you were too fat to be put in the scanner, you could not be put in the scanner. Along similar lines, if you weighed more than the table could support, it would be listed on a sign in big letters. They could not put you on the table. That soda contains sugar. I'm not going to hurry up suturing your mother's arm just because you want to go to Denny's. Shortness of breath is not caused by a sudden recent increase in cholesterol. Pouring Lysol on your foot will not stop your diabetic foot ulcer from becoming osteomyelitis, infection of the bone. Every time I eat nuts I get a bad bout of diverticulitis. Maybe you should stop eating nuts. A no added nicotine label on your cigarette box is not the same as no nicotine. If you're massively obese, you didn't just get type 2 diabetes because it just happens to people for any reason. No, I will not give you a ride in my car somewhere. Edit. Added clarification of type 2 because of Rumpf. So this happened when I was a family doctor. I got a call in the middle of the night. I was on call from a very distressed new mother. She said her newborn was projectile vomiting with every feed. Projectile vomiting can be a worrisome finding in a newborn, so I asked her to meet me in the ER right away. When I saw the baby, he was smiling, happy and in perfect good health. The mom assured me that he vomited with every feed, so I asked her to feed him to let me see what happened. She did, and as soon as she finished, the baby started to fuss then spit up the milk. I asked was this what she had been seeing. It was. So I asked her if she ever burped the baby. She looked at me puzzled. She had no clue about burping. She said she thought it was some TV thing. I assured her it was a real thing, and at 2 AM taught her how to burp a baby. I asked her to follow up with me in a day or two. She came in and said, "You are the best doctor ever. That burping thing you taught me is like magic. Now my baby is happy all the time." So there you go. Someone who did not know about burping a baby. How a shorter / fatter 5 ml oral syringe held more volume than a skinnier and longer 1 ml oral syringe. How does this hold more liquid when it's shorter? Also, I've seen almost every incorrect way to use an inhaler, upside down, being fairly common. People taking birth control pills only on the days they have sex. I no longer assume anything is common knowledge. I'd rather someone be offended that I explain something basic than to have something awful happen because I assumed the patient knew something. I used to perform fecal coliform counts on well water. Whenever someone in the county dug a new well, and periodically for existing wells, they were required to get a sample of their water tested to see how many colonies would grow on certain types of culture plates. The EPA wants a count of 0 for drinking water, so if they had counts, we'd recommend certain actions. I remember a customer asking what TNTC meant on her report. "That's too numerous to count," I said. Basically, the plate was covered in a lawn of fecal bacteria. Her next question: "Could this be why my kid is always sick?" Yes, it could be. A nursing home called 911 for a patient who was having difficulty breathing. When we arrived, a PA was standing in front of the patient vigorously fanning the old lady with her hands. She looked at us and said, "I'm giving her some oxygen," because we couldn't find a portable O2 tank, and keeps flapping her arms. Remember, this is a physician assistant, probably making 100K a year. I informed her that she could stop now, and my partner and I did our best to wait until we were outside to burst out laughing. Pediatric nurse here. I've told more than one parent that their infant should not be drinking Dr. Pepper out of their bottle, or any other vessel for that matter. I'm not a doctor, but I'm an ER nurse. I had a patient come in for an STD check. She was very upset and continued to tell me that she only had one partner. Progressing through my assessment, she further divulged that even if he was sleeping with other people, it shouldn't matter because he uses a condom every time and he makes sure to wash it thoroughly after every use. I asked what she meant when she said he washes it after every use. She explained that he washed the condom with hot water and soap before he used said condom again. I had to explain to her that condoms are a one-time use product. She had no clue. I had to ask permission of the paramedics to swear because there was a strict no swearing until you are 17 rule in my house. They looked very confused, sort of chuckled, and promised not to tell my mother. GG paramedics.